Hello, good morning.
Good morning, doctor.
I'm Dr. Bila, one of our children doctor over here. Am I talking to Mrs. Jones, mother of Dallin?
Yes, doctor. I'm Dylan's mother.
How are you doing, Mrs. Jones?
Doctor, I'm doing fine.
Okay. So I'm here today to discuss about Dallin's condition. Is that suitable time for you?
Yeah, doctor. That's why I'm here.
Okay. So do you want anybody else to attend with us?
No, doctor. I'm right now. I'm all alone, but Dylan's father may join this session anytime. So is that fine with you?
Yes, sure. So do you may I know that what do you know so far about Dallin's condition?
Uh, Doctor, Dylan is having swelling around his eyes for last 3, 4 days, and I'm scared that again he's having a relapse of nephrotic syndrome, and that's why I'm here. And when I asked one of
Yes.
the nursing staff over here, she told me that Dr. Bila will be coming to update you about Dylan's condition.
Yes. So you're right, and as you can see that Dallin's again developed swelling, and it's mean that nephrotic syndrome has come back, and this is known as relapse of nephrotic syndromes. Are you with me?
Yes, doctor, I'm aware of that nephrotic syndrome tends to come back again and again. I was told previously about it.
Yes. So we have again planned to start him on a medicine. As you know, there is always a medicine which is the first line medicine, steroid
Mm,
medicine.
mm.
So we have
No,
to start it.
no, doctor, no. I don't want these steroids for Dylan now
I
because
can see that.
every time when I start steroids, then what I see is that his whole body used to swell up, and I'm fed up with that. And I have read a lot of bad things about the steroids. So please don't give steroids to Dylan now, doctor. Uh, why don't you give some other medicine instead of steroids?
I can see that you are quite upset with steroids as there are side effects. You are right. But as this is the medicine which is the first line and it is one of the best in this condition. Am I making myself clear?
Yes, doctor, you are quite clear, but still I'm not comfortable that you start my child on steroids. Doctor, there
So
should be
this time,
some way out, isn't it?
yes, there are some other medicines, but they also have their side effects, and they have even more serious and irreversible side effects sometimes, and they can be they can
You you you
left
mean
some
to
of the
say
damage.
you mean to say that those medicines have side effects more than steroids? Is that what you mean to say?
Both have side effects, but the other choices they have sometimes irreversible side effects, but steroids
Hmm.
have reversible side effects. And in this time when there is relapse, we do not continue for high dose of steroids for 6 weeks. We will continue unless Dallin will attain remission, like until and unless the urine is clear, and after that we will switch to the alternate day regimes, and we will decrease the dose also. Are you with me?
Yes, doctor. This we did last time also, as you are telling me. But with this type of treatment, which you are telling me, with that also, he had a lot of side effects. He complained
Okay.
of tummy pain, and he complained of uh, he at time throws up. So I am more worried about that.
So we can minimize those symptoms of tummy pain and throwing ups by making some amendments, Like we can advise you to use it like some other medicine along with it to compensate
Mm-hmm.
the side effects, like
Mm-hmm.
some other medicines which decrease the acidity of the tummy, so we can use that also with that, so it will be
Okay.
minimized. But steroid is the mainstay and best in this condition.
Doctor, you are continuously telling me that steroids is best, steroids is best. Doctor, I want something else this time. So how about if you fix my meeting with your consultant? I want to discuss this issue with your consultant. And I have also read somewhere that when child develops some renal problem, then you all refer child to some kidney doctor also. So am I right?
Yes, yes, you are right. I will try to fix your meeting with my consultant as soon as possible. But there are some other
6 minutes,
options I want to
3 minutes
tell
left.
you about. It may cause some blood in urine, so we don't. And there are some potential to develop cancer also. So we never want that, and we weigh the risk and benefit. So the risk of
Mm-hmm.
giving the alternate choices are more than the benefits.
Mm-hmm.
Are Am I making myself clear?
Yes, doctor. I'm trying to understand what you are telling me.
Okay. So the renal doctor is going to go for some more invasive test, and I think that is not needed at this point of time.
Mm-hmm.
So I will fix your meeting with my consultant. So, Mrs. John, today we have discussed so many points about current condition of relapse of nephrotic syndrome. So, I want to recall, want to summarize again.
Yes,
So,
doctor.
today we have discussed about the relapse of nephrotic syndrome, which Dallin is having, and for that relapse, we need to start him on steroids, um, and then we will follow him up in the follow-ups to see the response of steroids and the side effects of the steroids. There
Mm-hmm.
are other options which you are more concerned, but the
Mm-hmm.
options they also have some side effects, like some of them can lead to cancers, so they're more serious side effects. uh,
Okay, doctor.
I will. Okay, thank you for understanding. And so do you have any more concern?
No, doctor. I'll think over it, and if I have any further concerns, then I'll get back to you. So, is that fine with you?
Yes, I will be happy to address your concern. You can come back again. So are you agree with this plan of treatment, or you will
Doctor,
take some time?
doctor, I told you that I'll think over it, and I want to talk to your consultant.
Okay. So I will provide you some links of steroid medicine side effects. You can
Mm,
read by yourself,
mm.
and I will refer you to my consultant. I will refer you to nephrotic syndrome nurse. Is that fine?
Okay, doctor.
Thank you.
Okay, thank you, doctor. 8 minutes 49 seconds.
कुछ मिसिंग था इसमें.
So, Dr. Bila, you started good. You introduce yourself, you establish a rapport, then you ask for a tender, and you asked my concern also. But what I felt throughout the communication was that you were not able to connect with role player in a way that you should connect. You should try to maintain eye contact with role player, and throughout the whole conversation, you should try to say, hmm, you should try to nod your head. You should try to say, right, okay, right. So that actually
Hmm.
promote a role player to speak out more. and to become more comfortable with you. Okay, so this is how communication is done. And then when I ask you about that doctor prescribed some other medicine, so you explained it to me uh, a bit more in detail. That is not needed. So you should have told me that, Mrs. Jones, I would like to tell you that this is the best medicine that is available for Dylan for nephrotic syndrome. And I can understand that you, mm, I can see that you are quite worried about the side effects of steroids, but I would like to tell you that this time we will be giving steroids for a shorter duration of time, and and we will be giving in a lesser dose. So yes, I agree that side effects will be there,
नहीं,
but
lesser डोज तो नहीं देते. डोज तो फुल होती है मगर अनलेस द रिमिशन.
so 2 milligram per kg per day, we will give it till child goes into remission. Okay.
हम्म.
So overall dose will be less now.
Oh,
Okay.
okay, okay, okay.
And then I mentioned you that I'm concerned about tummy pain. Okay. So that you replied well, that yes, I understand that it causes tummy pain. So what we will be doing is that we will be adding acid suppressing medicine along with steroids. Okay, so he will not experience tummy pain. And then I told you that I want to have meeting. So you say yes, I will definitely yes. I will arrange your meeting with my consultant. So you have to say, you have to agree on that. And then I told you that I want to have meeting uh, with kidney doctor.
Kidney doctor.
Yes, so you have to say that there are some conditions in which when that we keep an eye on, and if child is uh, not responding properly to the treatment that we are giving, then we may think of taking an opinion mm, from uh,
Kidney
child
doctor.
kidney doctor. Okay, so this is how you will be telling. But right now, as Dylan is responding well uh, to the treatment, so uh, so right now he don't need uh, opinion from kidney doctor. So this is how you can reply for that. Okay, don't go into a lot of detail that if we find blood in pee, or if if there is something else, then we will take opinion. Don't mention that side effects to mother, because that is not needed. So you have to say that Dylan is responding well to steroids. He has responded well previously also, and hopefully he will be responding well to steroids this time also. And I would also like to tell you that nephrotic syndrome, uh, which we commonly see in children, goes with time in most children. So it's just a matter of time. Fine.
Okay.